which are now adopting a more tropical climate, are seeing dengue cases for the first time. Dengue cases have gone up globally by about 300%, and it is now in over 123 countries. Just for clarity again, dengue has been endemic in Trinidad and Tobago since 1981. That is 43 years ago. And this morning, we have some doctors here who will be talking about their experiences in treating the last surge of dengue cases. As of 9:30 a.m. this morning, the latest figures are the number of laboratory-confirmed cases increased from 712 to 813, so roughly another 101 cases as of 9 a.m. this morning. The number of deaths remained the same at 8 at this point in time. The number of notices that have been issued by the public health inspectors is 441. So 441 house owners have been served notices to clean their premises to get rid of breeding sites. In addition, when we had our last press conference at the San Fernando Teaching Hospital, maybe around 3 weeks ago, the Insect Vector Control Division would have indicated they had personally visited, at that time, 150,000 homes. To date, that figure is now 160,726 homes have been visited personally. That is to give you some idea of the scope and range of the response that we are mounting. So that's the local figures as we stand this morning. I want to draw the country's attention to two other issues. One, at our last press conference in San Fernando, the issue of the Oropouche virus was raised, which is making its way through Brazil at this point in time. The Oropouche virus was first discovered and named, unfortunately, after Oropouche in Trinidad and Tobago. I have confirmed with CARFA this morning that we are now testing for the Oropouche virus in case we have it in Trinidad and Tobago. What CARFA is doing, the blood samples that we send to them to test for dengue, once those samples are negative, then they do a second screen for Oropouche virus, because the signs and symptoms tend to be the same, they overlap. So we want to know whether we are dealing with Oropouche virus at the same time. With the advent of floodings, which we have noticed yesterday and in days gone by, it is also important that we remind the population about flood-borne diseases, example, gastrointestinal diseases, but more importantly, leptospirosis. Leptospirosis is something that rears its ugly head every rainy season when we have floods, and people have no choice, really, but to go into flood waters to save property, livestock, and their lives. But we do ask you to resist the temptation to go into flood waters unnecessarily. Sometimes you see our children playing in flood waters. That is not advisable. I saw in one of the newspapers this morning a lady wisely wearing tall boots and going into flood waters. That is what we need to do. If you have to handle dead animals, use gloves, double plastic bag your hand. Dead animals at this point in time, because leptospirosis could be deadly, and it also mimics the dengue virus, it mimics the Oropouche virus, and our clinicians will speak more to those issues. Those are my opening remarks. I will now introduce our 5 panelists this morning to give you a short synopsis of what their areas of competence are and what we are doing to mount the national response to dengue. It must be noted and reminded, we started to alert the national population in January about mosquito-borne diseases. Our first ad appeared in the newspaper, I believe, on February the 2nd. We had our interview starting in February on radio with Dr. Mark Dukiram and others. So we continue our public education. First off, we have Dr. Darren Dukiran. He is the head of department at the A&E department at the Sangre Grande General Hospital. He will tell you his experience in treating dengue now, but also he was part of the team that was present in the last surge. So he will give you some insight as to what he noticed then and what he's noticing now. So I now hand you over to Dr. Darren Dukiran.
Thank you, Honorable Minister, and welcome. Good morning to all. So we've been called today to speak on a very important topic, and just to reiterate the Honorable Minister, the clinical signs and symptoms of a lot of the viral illnesses tend to overlap. With dengue, we see primarily fever, so high fevers, in addition to body pains, headaches, what we call retroorbital or pain behind the eyes, but also the presence of a rash. Honorable Minister is alluding to some of those symptoms being common in many of these diseases. So leptospirosis, for instance, can cause fever, can cause body pain. And it is important to contextualize that to understand that in the presence of high fever and body pain, one cannot just assume that it's dengue and will be self-limited. And that really prompts the conversation of needing to be tested early, seeking care early. So I know of cases where people have hesitated and they've come into serious difficulties because they have presented late to hospital. So I would really take the opportunity to urge everyone to present to one of the facilities that the ministry has set up, to have testing done in a timely manner, to have care delivered in a timely fashion as well. There's certain warning symptoms, and they'll be discussed today, as they have been by Dr. Richards and everyone else, that really would tell the general population to seek care early, to seek care quickly. So early identification is key. As was stated, this is not a new problem. I was a part of that group of physicians 10 years ago, but it certainly predates that, and it was a pleasure to work alongside them then as it was during COVID. But what we're seeing now mimics that, the increased numbers, the pattern of symptoms, the potential for complications. So it's an ongoing process where the ministry has continued to provide services, continued to ramp up things when problems are expected. And similar to 2010, we will do our best to ensure that patients get the care that they need, to provide that treatment in a timely manner when patients do present. The treatment is something that we will go into today as well, but really, I think my take on this is early identification and seeking care in a timely manner to ensure that we can prevent preventable problems. Thank you, Minister.
Thank you, Dr. Dukiram. Second up, no stranger to you all, Dr. Joan Paul. She's the Pediatric Emergency Specialist, Eric Williams Medical Science Complex. Because as you know, many of these cases are affecting children, especially the under 20. So we'll ask Dr. Paul to give her perspective.
Hi guys, good day, good morning. Just to reiterate what the others have been saying, in terms of pediatric emergency cases or pediatric cases, we've been seeing a similar increase as with the adults. The difference though, children present a little bit differently to adults. So with children, they will have the rash, they will have the vomiting, especially where they persistently vomiting. They will have the normal fevers with the adults. And the difference also is they present more cargo, as we call in Trinidad. They're a little bit more confused. They have more neurological symptoms, and they have the belly pain. So they have the abdominal pain, especially on the upper right side. But the adults, they will have the general body pains. They'll have the muscle pain, the bone pain, the pain, as Dr. Dukiran just mentioned, behind your eye, and they will feel incredibly sick. So for your child, if you're seeing your child lethargic, cargo, fever, vomiting with belly pain, and a rash, and you might also see on the palmar surfaces or the soles of the feet, so like they might be itching, so the rashes there and the itching, those are different signs to look out for. The thing about the children also, they lose that fluid really quickly, so you really want to give them lots of fluid to combat the dengue virus. So the first 7 days, remember we spoke about this before, fever, and then you have when the fever breaks, really critically, when the fever breaks, that's when they're at most risk of having more severe dengue. So if you think that's happening, look for your fever and also give them lots of fluids, even double the amount of fluids, and look and monitor carefully, especially when the fever breaks. As the minister was just alluding to, we have found that, that you've seen the difference in terms of the adolescents increases there and also 20 to 30 population. What I have found, because I was there 10 years ago, I'm still young, but I was there 10 years ago when they had the other surge, and we're seeing similar patterns now. But what you realize that the ones who are the younger age group and the adolescents, they may have not have gotten dengue then. So you're seeing them having a primary dengue infection and seeing that surge of the adolescents. And the 20s, 30s are the ones who are getting a second infection. And as we know, once you have a second infection after the first one, you now have an increased response and you might have more severe dengue. So the patterns, not just with us, all over the world. It used to be where dengue was mostly for the really younger age groups and the older ones. They've seen a shift where it's also adolescent and the 20 to 30 population. So for those who are, I'm young, I'm strong, still monitor. And I want to reinforce everything that this panel has been saying so far. The main thing, know what's happening with your virus, know the dengue virus. 7 days fever, the first one. 2 days where you're most critical, and then afterwards recovery. Know that, monitor yourself carefully, looking for what's happening. Take your fluids, and if you find you're having any warning signs, do not think I could handle this, I'm big and strong. Just go check yourself immediately, please, where you have providing the centers to make sure you're checked out. Thank you very much.
No, Dr. Paul just stated, because you raised an issue, and so before you go, I listened to you carefully, and my takeaway is after that fever breaks initially, people ought not to assume they are over the worst.
Yeah.
Could you elaborate on that so that people listening live on TTT will understand that after that fever breaks, you are not out of the woods?
Yeah, the thing is that to me, knowledge is power. So if you understand exactly what the pattern is like, you know what's happening. You're not in an unknown thing or I'm not sure what's happening with me. So clearly you know 0 to 7 days of fever. So during that time, you're having all the signs in terms of we spoke about the pain behind your eyes, etc. You know what's happening. In that period of time, you're looking for warning signs, which will tell you abdominal pain, persistent vomiting, any bleeding, they'll tell you. But significantly, after the 7 days, right at that crux where the fever ends, that's when you go into the 2 days of critical period. So either you get better at that point in time after the fever ends, or you have 2 days where you get much worse. That's a danger period. So therefore, what they tell you is that when the fever breaks, if you find that you're feeling worse, you're not getting better, if you see warning signs there, don't just think, I'll wait for a day, let's see what's happening, I'll have to cook or whatever it is. No, at that point in time when the fever breaks, crux time, if you're still feeling sick or you're not feeling better, go get yourself checked out. That's when you dip, that's when you get much worse, and that's a real danger time. And when that danger time is finished, then we have recovery time. But that 2 days, real serious danger time. So once you know the pattern, 0 to 7 days fever, 2 days critical, and afterwards 5 days recovery, you know what's going to happen to yourself.
Okay, thank you. So ladies and gentlemen of the media and those listening at home, Dr. Paul's timeline is crucial for us to understand how we need to respond as families and as patients, right? Let me just repeat. 0 to 7 days fever, the fever breaks. That next 2 days is absolutely critical if you don't feel better. Come in and get treatment, and that way we can save some lives. Our next expert panel, on the expert panel, is Dr. Kavita Ramlochan. She's a hematologist, a attached to San Fernando General Hospital. Dr. Ramlochan will be alerting the population as to how we treat severe hemorrhagic dengue or dengue where you have bleeding, which is one of the more severe forms of dengue. So Dr. Ramlochan.
Good morning, Honorable Minister, members of the press, and those viewing live. This represents severe dengue. Dengue hemorrhagic represents a very small percentage, but it's a significant percentage of dengue cases, just about 1 to 5%. These patients either can present quite ill at their first point of contact, or they may have presented, as my colleague had mentioned, going through the different phases with the viral illness, the febrile illness, the body pains, the retroorbital pains, and then progress to having warning signs, abdominal pains, vomiting, and bleeding. And it is this group of patients that we need to closely monitor. And ideally, these patients should be admitted as soon as possible, undergo continuous assessment, physical examinations, as well as laboratory investigations to decide based on these where do we need to treat these patients. Do they go to a high dependency unit, an intensive care unit, or can we keep this patient on the ward and closely monitor? When we monitor these patients in the hospital setting, oftentimes you would see that they would be encouraged to have oral fluids, but also be hooked up to what we call drips, IV fluids. And this is to maintain proper hydration, make sure that blood pressures and everything are within the expected parameters. If we've noticed signs of bleeding or further deterioration, meaning if the blood pressures drop, the blood parameters are not increasing or are deteriorating, these patients would either be sent to the high dependency or intensive care unit where they would get further monitoring. They may be started on medications to help deal with complications. And if bleeding, then we would have to request blood products for these patients. Depending on the clinical picture and continuous assessments, a decision would be made whether or not these patients would benefit from blood products such as blood transfusions or platelet transfusions, which our health facilities would have available.
Okay,
Yeah.
thank you very much.
You.
Next up, we have Dr. Ravi Lala. He's the Medical Chief of Staff of the Couva Medical and Multi-Training Medical Facility. He will be here this morning to tell you about an initiative that we have started since yesterday. In preparation for any increased number of cases, we want to be proactive, so he will tell us what is happening at Couva.
Morning, everyone. So to carry on from what the minister is saying, what we started at Couva yesterday is a proactive measure in keeping with what we could expect to happen regarding dengue, meaning the increase in cases. And what we started was a dengue early symptom screening center coming out of the Couva Medical and Multi-Training Facility. And the trust here is to echo what all of the speakers have been saying, what the minister has been saying, which is an early interface with the healthcare sector. So from early on, as soon as you start to have symptoms, our hope is that we'd have patients coming to us. And from there, we could do early assessments, we could do interventions as necessary, we could do screening for dengue, and importantly, we could set up reviews for patients. And so in that way, we would be going with the patients through their course of illness and being able to monitor and measure and intervene as necessary on an individual basis. And so I encourage everybody to take advantage of the facility as necessary. It's open Sunday to Sunday from 8 a.m. to 6 p.m. And our number is 226-4263. Thank you. That would be 226-4263. Okay.
Thank you very much, Dr. Lala. And to wrap up this part of the press conference, we now have Dr. Mariam Richards, Acting Principal Medical Officer of Health, to give you her perspective and to do a wrap-up before we go into questions and answers.
Honorable Minister, my medical colleagues, ladies and gentlemen of the media, and of course our online viewers joining us on TTT Live. Good morning, and thank you for joining us and for this opportunity to summarize the information provided by the Honorable Minister and my medical colleagues. This morning, I'd like to leave you with 4 takeaway points regarding dengue fever. And this is information that is in alignment with international best practice standards and guidelines from PAHO and the WHO. I'll start with summarizing the 7 key signs and symptoms of dengue fever. Now, these signs and symptoms typically resemble other viruses, so it's important that we monitor these symptoms not just in ourselves, but in our relatives and friends who may be very ill. These signs and symptoms are as follows: fever, pain behind the eyes or retroorbital pain, severe headaches, muscle and joint pains or body pains, nausea with or without vomiting, diarrhea, and a skin rash. Early detection and monitoring of these signs can reduce the risk of complications of dengue fever, such as the hemorrhagic types, as described by Dr. Ramlochan. We also need to ensure that our at-risk populations, that is persons with comorbidities such as diabetes, cancer, our young children, persons who are the elderly, and our pregnant population, are monitored and seek immediate and early medical attention. The message that we would like to really bring home and to reiterate is the need for immediate medical attention at any one of our public healthcare facilities, and now the recently activated Couva Medical Multi-Training and Medical Facility for dengue virus. Lastly, it is key to all of us to exercise personal and social responsibility in reducing the cases of dengue and the expected increase in cases of dengue in our country. We must all be our brother's keeper and not just manage the number of cases and their signs and symptoms, but also ensure that we take the necessary measures to reduce the source of dengue, which is the Aedes aegypti mosquito. Thank you very much, Minister, and I hand back over to you.
Thank you very much. So, ladies and gentlemen, you have heard from our 5 doctors this morning. I thank them for leading the charge this morning, and we now open up the floor to your questions. Just give your name and your media house. Yes, sir.
Good morning, Joey.
Just hold on 1 second. Do we have a mic?
Hi, morning. Joey Bartlett from Newsday. Does the RHAs have any manpower, any shortage? Sorry, manpower? Are we well stuck?
No, there is no shortage of manpower.
And what is the testing timeline for dengue?
The testing time, maybe one of the doctors could take that.
RHA, the turnaround time is done in-house, so it's within hours that you get back the test, if not sooner, depending on the urgency.
Oh, same day?
Absolutely.
Okay, cool.
Good morning, Minister. Good morning to all members of the panel. Jesse Ramdale from CNC3. Minister, just wanted to get your perspective on a bit of information you shared earlier. We've seen that over 440 notices they've been issued to homeowners. Are you satisfied with what you're seeing in terms of people taking actions to, their personal responsibility to address the spread of the dengue virus? Are you satisfied with what citizens are doing, or do you think there's still room for improvement?
Short answer, no. The citizenry has not stepped up to the plate, and I think the Express editorial of Sunday was a good one, where it said that the citizens expect the dengue response to be the responsibility of the government. The major response agency is the homeowner. And homeowners are not stepping up to the plate to rid their yards and their homes of these small to medium-sized containers, for example, buckets, unused dog bowls, water dishes, plant saucers, cleaning gutterings. They have not stepped up to the plate. Tires. I spoke recently about coming up Lady Young Road, because I pass there every morning. And on the flyover, not the flyover, the walkover, you have 6 plants planted to decorate the place. And you know what they have planted those 6 plants in? Tires. How does the government respond to that? And right after that, and you cross the walkover, on your left-hand side, there's a 3-tiered water feature. 3 tiers. And I am sure there is clear, clean, stagnant water in that. And that's in a community. And when you drive through the community, as I do, you see all of these features that collect water. The government cannot go and empty every single container. The population has still not, in my view, started to play their part in ridding their homes and their yards of breeding sites. And that is why we have to issue 441 notices, but I'm sure that is a drop in the bucket. So, Jesse, the short answer is no, the population needs to do much, much more. And I want to reiterate, plant life is not as important as human life. Too many people are telling me, well, what to do with my plants? I have to water my plants. I have to have a vase inside my house. You don't have to have a vase inside your house, especially if you are not going to empty that vase every week and scrub the inside to dislodge all the eggs that have been laid there. And remember, these eggs stay viable in what we call a desiccated or dry state for up to a year. So you have an egg here now that is dried out, but you add water to that egg a year from now, it springs to life. And we have been saying this since I became Minister of Health, and I'm sure previous ministers of health through the decades have been saying the same thing over and over. Okay?
Hi,
Any
Minister Shilan Ramsubag from the Trinidad Express.
Yes.
You would have mentioned the Urupuch virus. How do the symptoms for that differ from the dengue?
So what we said is that the reason for raising things like Urupuch virus, leptospirosis, dengue, is that the symptoms tend to overlap, fevers and so on. But I would like one of the doctors to maybe go into more detail if they want to. Yeah.
So thanks for that question. The Urupuch virus was first identified, like the Honorable Minister said, in Trinidad and Tobago in Vega de Urupuch. It's not something we have routinely tested for, but it's something that is well documented. Given the presence of so many people with fevers, and so through the Ministry of Health, we now have that access to testing. But to answer your question, it is very similar. So it's fever, body pain, just like most viral illnesses will cause. In this case, when people have their testing and it's sent, and let's say somebody has a negative dengue test, now the mechanism is that the TPHL has the capacity to test for the Urupuch virus as well. But I guess in the interest of the viewing and listening population, it is to know not all fever is dengue. There are other differentials that are possible. But regardless, you should have your testing done to ensure that the safest level of treatment is provided to you.
Any other questions? Jesse. Yeah. So let me reiterate. Spraying is a part of an integrated management approach to vector control. Whether it's the Aedes aegypti or any other, it is a part of a program of vector management. The other parts of vector management will be public education, home visits. So we have visited 160,726 homes. the issuing of notices, 441, public education, source reduction, which is the main thrust, and spraying. How does the insect vector respond to spraying? I remember when I first became a member of parliament in 2013, when chikungunya was the thing. I was walking through Moundo then, and residents were complaining to me about the mosquitoes in Moundo, and chikungunya was the thing. So I called insect vector based in St. Joseph on Queen Street to say, look, this is a complaint. The first question they asked me was, is there any confirmed case of chikungunya? I said, no, there's no, but people are complaining about mosquitoes. They explained to me then that spraying, whilst it is done on a rotational basis every 3 to 4 months, they do not go in indiscriminately and spray an area. What they will do, they will concentrate resources in a geographic locality around the house where there is a confirmed case to break the chain of transmission. Because if you overspray, 2 things result. 1, the mosquitoes build up resistance. And then when you spray in the future, it will have no effect on the mosquitoes. And 2, overspraying is dangerous to human health, animal health, wildlife, fish, parrots, bees, everything like that. So spraying is done as a part of an integrated management plan. And short answer, yes, we are spraying, but we are not blanketing the whole of Trinidad and Tobago in a fog of malathion. That can't happen. And also, you cannot spray too often because the life cycle of the mosquito, 75% of that life cycle is in water or underwater. And spraying only knocks down the flying adult population. You will then have to spray every 10 days. Nowhere in the world does that. It is scientifically unadvisable and socially irresponsible. So that is how spraying is used as part of an integrated management approach. Okay? Any other questions? Going once? Going twice? Gone? So I just want to do a quick wrap-up. The Ministry of Health continues to mount a robust national response to dengue. We are preparing for an increase in cases. That is why we have activated the Couva facility. I urge people to make use of that facility. We have introduced similar lines of treatment at the other RHAs. Eastern is doing something similar so that people on the eastern seaboard don't have to go to Couva. Northwest is doing something similar. So at all parts of the country, Northwest, Couva, Eastern, there are these facilities where you can go in for early screening, get all the advice you want, and I want to leave the population with one piece of advice. Because what I am seeing is a repeat of the COVID experience, where people just took too long to come in to be treated, to be diagnosed, and to be screened. Come in as early as possible, make use of the Couva facility or the facility up at Grandy or any of the other facilities for early testing, early screening. And hopefully with that, and I want to leave with a final plea, and this is a plea to homeowners. Your responsibility in this fight against the Aedes aegypti and dengue is the most important ingredient of this fight. You have it within your power to clean your gutterings, cover your barrels with meshes, empty out all your saucers that contain water, the holes in your block walls that contain water. The government cannot go into all those holes in your block walls. Please work with the government, follow the advice, And if you can clear your homes and your yards of all these sources where the Aedes aegypti can breed the expected cases that we are anticipating and preparing for, we could have a severe dent in that. And also ensure that not many more people succumb to this virus. We don't want a repeat of what we saw in 2014, where at that time somewhere between 14 and 20 persons died. We don't want to see a repeat of that. We are currently at 8 and coming as early as possible for treatment. Ladies and gentlemen of the media, I thank you very much. And those listening on TTT and other platforms, I wish you good morning.
The winning numbers in the National Lottery online draws for Tuesday, 13th August 2024 at 10:30 a.m. Playway, the number 27, Little Snake. Pick 2, the numbers 26 and 18 in that order.